Hi there, this is Jason Eagle with another snippety pippet of health, and this one's on massage, and this one's jaw massage. Actually, a lot of people can do it, but it takes a lot lighter pressure than you could possibly imagine, because when you push on somebody's, so think about your jaw muscles, okay? So there's what's called masseter, so you can massage here. So this is yourself, but you can also, it's great to have someone else massage you. If you can have a person say, you know, scratch my back, can you massage this? A great way to do it is to sit behind a person and kind of have them, either you're standing above them, or you can even lay down on the couch or lay down on the bed and then have their, like you're kind of kneeling, not kneeling, but like you're sitting on your butt with like your legs crossed, and you have their head lay on a pillow or just lay flat on the bed or the mattress, and you're massaging. Now, also in my clinical work, I do actually internally. So with the glove on, but if, you know, basically you got clean fingers and it's a loved one, your wife, your kid, your husband, sister, brothers, uncles, whatever, wash your finger off and stick your finger inside the mouth. And that's where we're actually going to the different muscles on the outside and the inside. And again, the pressure is so light. It's not going to take a real deep pinching, because people tell you, oh, like that's really good. So or that's really bad, like it really hurts. And then afterward, oh, whoa, wow, like my jaw can open so much better. So a lot of people with headaches. So let's talk about the jaw muscles. You can see as I open and close, this one here, when you see a guy standing in line and clenching his jaw and these things flexing, that's called masseter. That's the one that's on the outside of your teeth, right? Then there's some muscles that are underneath that. There's what's called the external pterygoid and internal pterygoid. It's actually spelled like a P, like a pterodactyl. And then, so those are all the jaw muscles. On the outside, the masseter, you're kind of massaging on the outside. You can go on the other side of the masseter by sticking your finger in the cheek and like pinching it. Oh, that's masseter in there. And then the ones where you go on the inside is when you stick your finger straight back. If you open up your mouth right at the back of the hinge point, you're pushing straight in, and basically you can even kind of put your finger to the side and kind of bite down on it, kind of like teething. You can have a person, okay, now don't bite my finger, but my finger will kind of get, and what we'll do is we'll squeeze. There's one that you can get it in between. There's one on the outside, where the teeth are here, and then you'll go way back, and there's straight back of the hinge, and then go up a little bit just above that hinge, as you'll feel that other muscle that you're going to go in between. And then you can also go on the inside, behind your teeth. We're talking about where the wisdom teeth, and where way back in there. And again, just putting pressure on these things. And then if you can get your finger in, so what I will do with people, stick the finger in, sometimes a pinky finger in there because my finger's too big, and then have them bite down and squeeze, and it's almost like teething on that muscle. Then when you see here, this is temporalis, you can see when people are chewing those muscles, so all the way up into the skull. So massaging those muscles too, and you can get a little bit deeper in those ones, and you can do just deep pressure straight in. You can do circular movements. You can do flushing movements, which is you can flush it back. You can also flush stuff down. So massaging because literally you can drain bad fluid out of there, pain fluid. So when you get jaw massage, then, whoa, now like you'll feel like your mouth opens a lot bigger, moves better, you can talk better, you're more relaxed. A lot of times when people are tense, they're grinding their teeth and get very tense. And then that sends signals that goes down the rest of the whole body. So you're tight in the chest or tight in the belly, you can just massage the jaw muscles. And then also, again, it helps with headaches. A lot of headaches come from, especially people say, oh, I got the sinus headache right here. They're actually clenching their jaw. And what it's doing is these muscles that are on the outside, you're literally squeezing, like if someone came in and like crushed you've seen those movies where the big guy comes and crushes people's heads. That's a lot of times what a headache is that your head is being crushed. Your brain is being squeezed, literally, because your skull shrinks. Because you have these sutures and you think that it's solid and doesn't move. Oh, it expands and contracts, and it certainly does. So it can be very tight muscles, like on the what's called temporalis, can be like an anaconda, just like a boa constrictor, just squeezing your head and brain, which will then go down the rest of your body. So getting a temple massage, jaw massage by somebody else is extremely relaxing. Almost kind of like, you know, when you get your hair washed by someone or hair cut, it's like, like it knocks you out. Just tingles all the way down to your feet. Those tingles are actually good healing hormones, and it's like, it's very, very healthy for the body. So that's jaw muscles, TMJ, temporal mandibular, that's the mandible joint. And TMJD is temporal mandibular joint dysfunction or disease. And that's very fixable, but helpable. And even if you don't have TMJ problems, a jaw massage is something that try this on a baby. Try this on a little kid and they'll be like zone right out, and then come out of it be like, woo, I'm ready to play. I feel happy. So till next time, bye-bye.
Make sure to subscribe so you get more great videos on homesteading and health and turkeys and chickens and sheep and cows. So hit that like button and subscribe.